continuous establishment of SDG goals in Bangladesh has shown excellent records with a maximum possibility of empowering opportunities following the tremendous success in achieving the Millennium Development Goals. But as a matter of fact, the development in the issues of hunger, malnutrition, poverty and health services are yet to meet the expected standard. The consequences of malnutrition remain an alarming crisis in Bangladesh, since about 5.5 million children are suffering from chronic malnutrition. And among the acutely malnourished, 14% are wasted and 33% are underweight. Not only children, but also the mothers suffer from the lack of proper nutrition, while more than 50% of women suffer from chronic energy deficiency. The overall scenario is more critical in the remote parts of the country. In Gaibandha and Kurigram districts, around 60% household reported food deficiency. Complementary feeding practice is not followed for 6 to 23-month children. In Nilphamari and Rangpur, around 59% of households do not get basic health services. In Chittagong Hill Tracts, 21% female and 24% male children less than 5 years of age suffer from severe stunting, and around 62% adolescent experience body mass index below the cutoff of 18.5. Bangladesh National Plan of Action for Nutrition, NIPAN-2, is establishing 5 core nutrition platforms under the BNNC, namely nutrition-specific, nutrition-sensitive, monitoring and evaluation, advocacy and communication, and capacity building, to strengthen the agency to steer and guide nutrition decisions and actions in the country.
This is a flagship initiative in the developing world. The program is very closely linked with the upcoming food and nutrition security policy of the country. This will be a big boost in Bangladesh government's one of the key priority intervention.
In Bangladesh, we recognize that the government has achieved food self-sufficiency, and that is commendable, but we still have to work on the diets and improving the nutrition of the children. The European Union has an envelope of 700 million euros for this 7 programmatic period in Bangladesh. Out of it, almost 50% is dedicated to food and nutrition security. And under that portfolio, we have launched a call for proposals, for which we have received very interesting proposals to work with consortia in nutrition governance.
Bangladesh Initiative to Enhance Nutrition Security and Governance, BIENGS, aims to improve maternal and child nutrition in Jamalpur and Sherpur Districts, aligning with the country's second National Plan of Action for Nutrition, NIPAN-2.
It is a multi-sectoral project. It accounts for every aspect of required need to enhance for a nutritional outcome of the community or of the families.
Main difference between this project, also other ongoing nutrition projects across the country, is the governance issue. This project is mainly improve the existing governance issue, directly work with Ministry of Health and Family Welfare, especially community-based healthcare, Institute of Public Health and Nutrition. Also other part, this project also going to work with Department of Agriculture Extension, Department of Livestock.
We are working for the changing behavior, nutritional behavior improvement that relate to from wash, hygiene and nutrition concept, understanding, then changing behavior. Then once they have the knowledge and they have the demand for, then they need either nutritious food supplement from their own production or ability to buy from the market and feed into their children and lactating mother.
This project also help farmer to gain access to market, and that is how they will get fair price of their produces, and the money they have from the proceed they will use for purchasing other nutrition rich food. As this project going to link the producer group with service provider, both private sector and public sector, so this group will be continuing to receive the services from this sector. So this is a contributory aspect of sustainability of this project.
So this project is also unique from that aspect. It is creating the demand in the community. complementing the knowledge, helping them to change their behavior. On the other hand, making the service department sensitive and responsive to the services. So to do that, we are working directly with the government departments, those who are responsible to provide this service. We are working directly with the community to demand the services. At the same time, we are developing some community-based institutions. Those will be making the service center, the community center, responsive and accountable to them.
End of this project, the knowledge or capacity will be there with service provider, and the behavioral pattern or change that will happen over the period, that will continue by the beneficiary. At the same time, the community-based nutrition initiative by the government will be available even when project is not there.
By securing the nutritional need of mothers and children, we can get a nation of healthy and resilient people who will lead the country towards a prosperous future.
The beauty of this overall initiative is that the greater partnership between the bilateral donors, government, and the development partners. And this partnership is not only focusing on a piecemeal basis solutions, but a comprehensive 360-degree sustainable solution so that Bangladesh could achieve the agenda of goal 1, 2, 3 and 6. We do believe that the spirit of this achievement will continue even after this project.